The Chopstic grip for Phacoemulsification.
Thank you, sir, for giving me the opportunity. And ladies and gentlemen, this is altogether different subject from all the previous presentations. And when I was learning Phaco, I started doing sitting superiorly, and I was thinking, the whole world is changing towards the temporal incisions. Should I change the position or not? And then over a period of time, I developed this grip, which I thought is of use to everyone. So whenever we do cataract surgery, we need to have an incision plan, and based on that incision plan, we will make a total orientation about our cataract surgery. When we do two-port phaco, so either we can do a two-port phaco or we can do a three-incision surgery where you have a main port and then you do side port, two side ports. And this two-port phaco is based on the concept of vitrectomy, where you are putting two ports at an angle of 120 degrees. The reason of sitting superiorly is because if you do this 120 degree and we sit temporally, the major port goes below the horizontal meridian. Here is another advantage, is that if you use air, you can use the buoyancy pressure to do the internal tamponade. The disadvantage is difficulty in surgery while operating in the left eye in the deep-seated eyes. So when I was attending a meeting in ESCRS, there were 4 live surgeries and 2 of the surgeons were sitting superiorly. I got some relief. One of the surgeons said that because I was having some difficulty, so I changed the phaco tip. So they have made a special curved tip for that surgeon. Probably that was Kelman. Because I did not have that support of changing the tip, I thought there should be some more solution, and the solution I found was just change your grip.
Hi, today I am going to tell you about the Chaturvedi Chopstic grip, and you will realize simple change of grip will make how much difference in your life. Normally we hold the phaco with a pen grip. So this is pen grip. If you hold it by pen grip, then the depth achieved is this. Now, what I will do, I will change it to the chopstick grip. This is a pen grip, and I will now convert it to chopstick grip. By going chopstick, you can go deeper. And that's the beauty of this grip. Instead of a pen grip, you go chopstick. With this grip, you can go inside quite deep. You can go subincisionally, you can move around and rotate pretty well.
So it's something like a special table tennis grip, where you use a different type of grip and you play very nice table tennis. And that's a video display of on-site actually how do you hold. You're holding the phaco machine from phaco tip from quite far off, and your surgery becomes really very easy. And the purpose of showing this video is to just show that with this grip you can operate on practically every type of cataract. So this video is self-explanatory. You just have to load the captions. The idea is based on the Phacoemulsification grip, where we were told in our fellowship days how to do vitrectomy, where to put the ports, where to put the instruments, how to move the eyeball 360 degree over the x-axis, y-axis and z-axis to reach all the 360 degrees in the eye using only 2 port. And when we can operate on both the eyes sitting same at 3 millimeter away from the limbus, from the far pars plana, why can't we do that sitting at the limbus? So these incisions are superiorly located. They are definitely stronger than the temporal incision. And they are astigmatically neutral. So we did a 3-year study over our 2.8 millimeter incision. So we did a 3-year study on our 2.8 millimeter incision, and we found that the post-operative data and pre-operative data, when they were compared, the difference in astigmatism was statistically not significant. So this we have presented 3 times consequently, one in AIOS Calcutta, then the next year and the next year. And our examiners asked, what is different, Dr. Chaturvedi? 2.8 millimeter incision doesn't cause any difference. Everybody knows about it. And I said, if that is the case, what is the whole fuss about sub 2 millimeter incision cataract surgery? So that is the thing. By the basic purpose of making this presentation is that we can have universal incision location, universal port orientation for all the eyes, for all the patients. And if we are going to make our case streamlined, then the same surgery can be put to everybody and it will yield the same result. That's all. Thank you.